Hey everyone, welcome back. Today we're going to be doing a deep dive into something that I think you'll find pretty interesting.
Yeah, definitely.
We've got these excerpts from a medical article,
Mhm.
and it's all about alcohol shakes and tremors.
Uh-huh.
I don't know about you, but I always kind of thought of those as, like a Hollywood thing.
Right.
It's like, oh, you see someone going through withdrawal in a movie and they're all shaky. But
Yeah.
the more I read this article, the more I realized, like, wow, this is something that can actually happen to, pretty much anyone who drinks.
Yeah, you don't have to be, like a hardcore alcoholic or anything to experience these kinds of things.
So let's maybe start with like a basic definition here. For
Sure.
someone who's listening and they're like, what exactly are alcohol shakes?
Well, basically, they're just what they sound like, right? They're these tremors that you get.
Mm-hmm.
Usually it's in the hands, but it can be in the arms, legs, even your head and face in some cases.
Really?
Yeah, and it can be pretty intense. I mean,
Yeah.
imagine
I can't even imagine.
trying to like button up your shirt or hold a glass steady when your hands are shaking like that.
Oh, gosh.
Makes everyday stuff pretty difficult.
Yeah, absolutely. And I always thought, like I said, I kind of associated with withdrawal.
Yeah.
If someone's going through withdrawal, they're going to have the shakes. But the article mentions that there are all these other causes too.
Yeah, for sure.
What are some of the other reasons why someone might experience these tremors?
So we can actually group the causes into kind of four main buckets.
Okay.
There's withdrawal itself, of course, but then there's also alcohol dependence.
Uh,
Just being intoxicated can cause them.
Really?
And then sometimes even certain medications can have tremors as a side effect.
I did not realize that you could get shakes just from being intoxicated. I
Uh,
always thought it was a withdrawal thing.
it's kind of a surprise to a lot of people.
Yeah, and what about those hangover shakes?
Mm,
I've definitely felt a little shaky after a night of drinking,
yeah.
but I'm not dependent on alcohol or anything.
Yeah, and that's what's so interesting, right? Like, even moderate drinkers can experience those hangover shakes if they have a bit too much one night.
So what's going on in the body that causes that?
Well, it all comes down to how our bodies process alcohol. You see, alcohol is a depressant, which means it slows down your central nervous system.
Okay.
But when you drink a lot, especially in a short amount of time, your body tries to fight back a bit.
Ah,
It starts producing stimulants to counter those depressant effects.
interesting.
So when you suddenly stop drinking,
Mm-hmm.
your system's kind of thrown out of whack. It's used to having all that alcohol there, and suddenly it's gone. So it goes into this like overdrive mode.
Ah, I see.
And that can lead to those shakes along with things like anxiety, sweating, nausea. It's basically your body rebelling.
It's like a rebound effect almost.
Exactly.
Okay, that makes sense. But what about those shakes that happen while someone's actually intoxicated? How does that work?
That's a great question. And it has to do with how alcohol interacts with certain neurotransmitters in the brain.
Neurotransmitters. Remind me what those are again?
Think of them like the brain's little messengers. They allow the brain cells to communicate with each other.
Okay, yeah, like the brain's internal communication system.
Exactly. Now, alcohol messes with the balance of two key neurotransmitters,
Uh-huh.
GABA and glutamate. These two have kind of opposite roles.
Okay.
GABA is inhibitory. It calms things down, promotes relaxation.
Mm.
Glutamate, on the other hand, is excitatory. It stimulates brain activity.
So alcohol basically throws off the balance between these two.
Right. Initially, alcohol actually enhances the effects of GABA.
So that's why people feel relaxed after a drink or two.
Exactly. But as you keep drinking, alcohol starts to suppress the release of glutamate, and that's where things get tricky.
Okay, how so?
Well, you see, glutamate plays a crucial role in muscle coordination.
Ah.
So when alcohol suppresses glutamate, it's like the communication between your brain and your muscles gets all scrambled.
I see.
And that can lead to those tremors even while someone's still intoxicated.
So it's not just a withdrawal thing, like you said. Even just having a lot to drink at once can mess with that balance enough to cause those shaky movements.
Exactly. And it's worth pointing out that even chronic heavy drinkers, people whose bodies are more used to alcohol,
Right.
they can still experience those shakes while they're intoxicated because of that constant disruption.
Wow, that really underscores how powerful alcohol's effects on the brain can be.
For sure.
And earlier you mentioned that some medications can also cause tremors. Can you tell me a little more about that?
Yeah, certain medications, particularly ones that affect the central nervous system,
Okay.
they can sometimes have tremors as a side effect.
So it's definitely something to be aware of if you're taking certain medications. It's like alcohol shakes can be a symptom of many different things, not just a simple sign of overindulging.
Absolutely. And speaking of symptoms, it's important to remember that alcohol shakes don't usually occur in isolation.
Oh, right. The article mentions that there's like a whole cluster of symptoms that can go along with the tremors.
Yeah, exactly.
What are some of the other things someone might experience alongside those shaky movements?
You might see nausea, sweating, anxiety headaches,
Hmm.
and in more severe cases, especially during withdrawal, things can get even more serious, like hallucinations or even seizures.
Hallucinations and seizures. That sounds really scary.
It can be, which is why it's so important to recognize those early symptoms and get medical help if you need it. One thing that people often overlook is the role of dehydration.
Dehydration.
Yeah, when you're sweating a lot during withdrawal, you're losing fluids, and that can actually make those other symptoms feel way worse.
Oh, that makes sense. Dehydration on its own can be pretty awful.
Absolutely. And the article also talks about the connection between anxiety disorders and alcohol shakes.
Oh, right.
If someone has a history of anxiety or other mental health conditions, those can really intensify the whole withdrawal experience.
So it's not just about treating the physical symptoms, it's about understanding the whole person and their individual needs.
Yeah.
Now, I'm curious about how doctors actually go about diagnosing alcohol shakes. Is it as simple as someone saying, "Hey, doc, my hands are shaky"?
It's a little more involved than that. Usually, doctors use a three-pronged approach.
Okay.
They'll take a thorough medical history, they'll conduct a physical exam, and then they'll order some laboratory tests.
So it's like building a complete picture of the person and their relationship with alcohol.
Exactly.
When a doctor is taking someone's medical history, what kind of questions might they ask about their drinking habits?
They'll want to know how much the person drinks, how often, what types of alcohol they prefer. They'll also ask about any past attempts to cut back or quit,
Uh-huh.
any history of withdrawal symptoms, any other medical conditions, especially mental health conditions that might be relevant.
Gotcha. And then what about the physical exam? What are they looking for there?
During the physical exam, the doctor will assess how bad the tremors are, how long they last, what parts of the body are affected. They'll also look for other signs of alcohol-related health issues like liver enlargement or signs of dehydration.
So it's like putting all the pieces of the puzzle together.
Right.
And you mentioned laboratory tests. What kinds of tests are typically used to help diagnose alcohol shakes?
There are a few different ways to measure alcohol levels in the body.
Okay.
Breathalyzers are pretty common, as are urine tests.
Mm.
And believe it or not, they can even use toenail tests.
Toenail tests.
Yeah, to measure alcohol consumption over a longer period.
Wow, I had no idea.
It's because alcohol metabolites, basically the byproducts of alcohol breakdown, they can get incorporated into hair and nails as they grow.
That's fascinating.
So a toenail test can actually give you a snapshot of someone's drinking habits over the past few months.
Huh. So it sounds like lab tests are just one part of the equation.
Yeah.
You mentioned earlier that doctors also use specific diagnostic criteria for withdrawal. What are those all about?
Right. So besides just measuring alcohol levels, doctors use standardized tools to assess how severe the withdrawal symptoms are.
Okay.
One common tool is called the CIWAR, which stands for Clinical Institute Withdrawal Assessment for Alcohol Revised. Yeah, it's a bit of a mouthful.
So what does it actually measure?
It's basically a checklist of symptoms.
Okay.
Things like nausea, sweating, anxiety, tremors, agitation, even hallucinations.
Wow.
And each symptom gets a score based on how bad it is.
I see.
So it's not just looking at the shakes in isolation, it's taking into account the whole range of withdrawal symptoms.
So the higher the score, the more severe the withdrawal.
Exactly.
Yep.
And that helps doctors figure out the best course of treatment.
That makes sense.
Hmm.
Speaking of treatment, that's what I'm really curious to dive into next. What are the options for helping someone who's experiencing alcohol shakes?
Well, the good news is there are effective treatments available, and we'll explore those in detail after a quick break.
Okay, sounds good. We'll be right back to talk about treatment options, so stay tuned. Welcome back. So before the break, we were starting to get into treatment options for alcohol shakes.
Right.
And you mentioned that while some mild cases might clear up on their own, it's generally a good idea to get professional help.
Yeah, absolutely. Especially if the symptoms are more severe.
What kind of complications can come up if someone tries to just tough it out on their own?
Well, untreated alcohol withdrawal can actually be pretty dangerous.
Really?
Yeah, you could have seizures.
Oh, wow.
And there's also something called delirium tremens, which can be life-threatening.
Delirium tremens.
It involves confusion, agitation, hallucinations. It can get really scary.
And you're saying that can happen if someone's going through alcohol withdrawal and they don't get treatment?
It's definitely a risk.
Okay, so it sounds like seeking professional help is the safest and smartest way to go.
For sure.
So what does treatment typically look like for someone who's experiencing alcohol shakes?
Usually it involves a combination of three main approaches: detoxification, medication, and therapy.
Okay, let's bring those down one by one.
Mm.
Starting with detox,
Yeah.
what exactly does that involve?
So detox is basically the process of gradually reducing alcohol intake under medical supervision.
Okay.
The goal is to minimize those really intense withdrawal symptoms and make sure the person's safe and as comfortable as possible throughout the whole process.
So it's not just about going cold turkey.
No, no, no. Suddenly stopping drinking after you've been drinking heavily for a while can be really dangerous.
That's why the medical supervision is so important.
Exactly. Now, the level of supervision depends on how severe the withdrawal symptoms are.
I see.
Some people can do outpatient detox where they go home each day but check in regularly with doctors or nurses.
Okay.
But for more serious cases, inpatient detox might be necessary.
What happens during inpatient detox?
Inpatient detox usually means staying at a medical facility where you can be monitored around the clock.
Mm-hmm.
Medical professionals can give you medications to help manage those withdrawal symptoms. They'll monitor your vital signs and address any medical complications that might come up.
So it's like a safe and controlled environment to help someone get through that initial phase of withdrawal.
Exactly. And for some people, just having that break from their usual environment and triggers can really help them get started on the road to recovery.
Mm-hmm. Makes sense. Yeah. You also mentioned medications as part of the treatment process. What role do medications play in managing alcohol withdrawal?
Medications can be a huge help in making withdrawal more bearable and reducing the risk of complications.
Okay.
One class of medications that's often used is benzodiazepines.
Benzodiazepines.
You might have heard of them. They're sometimes prescribed for anxiety.
Right.
They have a calming effect on the central nervous system, so they can help reduce anxiety tremors and the risk of seizures during withdrawal.
So they're not specifically for alcohol shakes, but they help manage those other symptoms that often go hand in hand with withdrawal.
Exactly. They help smooth out the process and make it more tolerable.
Okay, what about other medications?
Some other medications that might be used include beta blockers, which can help with things like tremors and a rapid heartbeat. And then there are anticonvulsants, which can help prevent seizures.
So it sounds like there are a lot of different options that can be tailored to the person's individual needs.
Absolutely. It's not one size fits all. The choice of medication or combination of medications really depends on a lot of factors, like how severe the withdrawal symptoms are, the person's medical history, any other health conditions they might have.
So it's a personalized approach.
Definitely.
And along with detox and medication, you mentioned therapy as a key part of treatment. What does therapy focus on in the context of alcohol shakes and dependence?
Therapy is all about getting to the root of the problem.
Okay.
It helps people understand why they drink, develop healthier coping mechanisms, and build a strong foundation for long-term sobriety.
So it's not just about managing those physical symptoms. It's about addressing the underlying psychological and emotional factors that contribute to alcohol dependence.
Exactly.
What kind of therapy is typically used?
There are a lot of different types of therapy that can be helpful. One that's commonly used is cognitive behavioral therapy, or CBT.
Right, I've heard of that.
It helps people identify and change those negative thought patterns and behaviors that lead to drinking.
So it's about learning new skills and breaking those unhealthy habits.
Right. And there are also therapies that focus on motivation and goal setting, helping people clarify their reasons for wanting to change and make a plan to achieve their goals.
It sounds like therapy can be really empowering.
It is. It gives people the tools and support they need to take control of their lives.
You also mentioned support groups like Alcoholics Anonymous. What role do those play in recovery?
Support groups can be amazing for people in recovery. They provide a sense of community and accountability.
Sure.
You're not alone in this journey. And having that support system can make all the difference.
It's about connecting with others who understand what you're going through.
Exactly. And it can help people stay on track with their recovery goals.
So we've talked about detox medication therapy and support groups. It sounds like there's a whole network of care available for people who are struggling with alcohol dependence.
There is. And the most important thing is that people know they're not alone and that there's help available.
Absolutely. Now, I'm curious to shift gears a bit and talk about prevention. What steps can people take to avoid developing alcohol shakes in the first place?
That's a great question, and one that we'll definitely dive into after a quick break. Stay with us.
And we're back, ready to talk about how to avoid those alcohol shakes in the first place.
Absolutely. Prevention is key.
So where do we even begin?
Well, it might sound obvious, but moderation is crucial.
Okay.
The CDC has those guidelines for moderate drinking.
Right.
Sticking to those can really help reduce the risk of developing alcohol dependence and all those nasty withdrawal symptoms.
Those are 2 drinks per day for men and 1 drink per day for women, right?
That's right. And it's not just about the quantity either. It's about paying attention to your drinking patterns.
What do you mean?
Like, why are you drinking?
Yeah.
Are you drinking to socialize, to relax, to cope with stress?
That's a good point.
Recognizing those patterns can help you make healthier choices.
So it's about being more mindful and intentional about your drinking?
Exactly. And that leads us to another important prevention strategy, managing stress and anxiety in healthy ways.
Right. Finding alternatives to alcohol for dealing with those tough emotions.
Absolutely.
Yeah.
So if you're feeling stressed, instead of reaching for a drink, maybe go for a walk, meditate, call a friend.
It's like building up a toolbox of coping mechanisms that don't involve alcohol.
I love that analogy. And remember, if you're struggling to manage stress or anxiety on your own, seeking professional help is always an option.
Therapy can be such a valuable tool.
Definitely. Therapists can teach you practical skills for dealing with stress and changing those negative thought patterns that can lead to alcohol use.
So it's not just for people who already have a problem with alcohol. It's for anyone who wants to improve their mental and emotional well-being.
Absolutely. And finally, I want to emphasize that seeking help for alcohol dependence is never a sign of weakness.
Right. It takes a lot of courage to ask for help.
It does. It's a sign of strength and a commitment to your health and well-being. And there's no shame in it.
There are so many resources available to support people on their journey to recovery.
Absolutely. Detox programs, therapy, support groups, online resources, there's help out there.
Wow. This deep dive has been so informative. I feel like I've learned so much about alcohol shakes and alcohol dependence.
It's a complex topic, but I'm glad we could shed some light on it.
Me too. What would you say is the most important takeaway for our listeners today?
I think the biggest takeaway is that alcohol, even in moderation, can have a real impact on your body.
Right.
Alcohol shakes are just one example and often a sign that something more serious might be going on.
So it's important to be aware of those signs.
Absolutely. Pay attention to your drinking habits, understand the risks, and don't hesitate to seek help if you're concerned.
That's such an important message. Thank you so much for sharing your expertise with us today.
It's been my pleasure.
And to all of you listening, thanks for joining us for another deep dive. We'll see you next time.